Good evening, everyone, and welcome to our sinus congestion talk. It's all about, us feeling stuffy and what we can do to help ourselves. So just up front, we base this talk on Dr. Jocker's article on sinus congestion, the causes, the symptoms, and the support strategies. And it's going to be presented by Dr. Udani today. So we know that there's lots of questions. And sometimes it becomes a personal question. You see something and you really want to understand more. Dr. Udani is available at 416-525-4850, and you can text her any of the questions and she'd be happy to answer them. So I wanted to welcome Dr. Udani. She is a registered naturopathic doctor, and she is on staff here at Justine Blainey Wellness Center. She interned at the Brampton Civic Hospital in their clinic on a wide range of medical concerns and really got a great exposure. So she really has some areas of expertise that she likes to focus in on and do additional research. And so, things like skin conditions and stress, chronic pain, digestion, and about women's health. She's an amazing practitioner, so patient with her patients. And I can attest from personal experience, she really has a philosophy that she's genuinely believes that everyone has that ability to make healthy and long-lasting changes. I think with the right information and the right coaching, and she's an amazing coach. Please help me welcome Dr. Udani.
So today we're talking about chronic sinus congestion, causes, symptoms, and support strategies. So this is from Dr. Jocker's, this article. He's wonderful. If you ever want to go check out, he has so many resources. And this article, this presentation is created from the article about chronic sinus congestion. So how do sinuses work? So I'm sure, you've woken up and, one day you felt really stuffy right, up here in your nose area, and then you might have even had a headache. You might have felt this pressure behind your eyes. So this is all because of potential sinus congestion. So sinuses are actually, they're kind of these hollow cavities that we have in our skull that drain out fluid, and they help to drain out fluid in the body. And they kind of usually drain into the nose or into the mouth, or sometimes into the eyes. But sinuses work in that way, and they are usually covered by these cells, line of cells, and it helps kind of regulate this fluid flow. If these cells are for some reason damaged, it can't regulate the fluid flow, and you get this congestion in there. This could be because of an infection or an irritation that's happening. So you feel the stuffiness, you feel this constant phlegm. So these are all symptoms of how a sinus can be kind of not doing its optimal function. So these are some of the sinuses, like I mentioned. We have, it's kind of cute, right? It looks like a little butterfly wings, but they're really great to help with breathing. If you ever know someone that has a deviated septum, so you can see right in the middle, the septum is kind of where your nose is, and that really affects the way you breathe. So these are all like this, these are like air pockets, think of like that are in and around our face that help with regulating for breathing or for oxygenation, and of course fluid as well. So major cause of a sinus congestion. So like I mentioned, it could be an infection. So it could be bacterial, viral, it could be mold exposure. You can get environmental allergies that can just constantly irritate the sinuses, nasal polyps, food sensitivities, we'll talk about that as well, and of course histamine intolerance too. So basic facts about a sinus infection. Okay, so we kind of talked about what they are. They're air-filled spaces in the skull, and they're pretty much kind of located right in this area. And the sinusitis, which is when the sinuses become inflamed, it actually affects a lot of people. It's very common, more common than you think. And sometimes these symptoms can last just a week, or they can last a long time, so up to 3 months or longer. So that's chronic symptoms. And we need to figure out what's irritating these sinuses, what's damaging these cells, and then that's leading to this infection and the feeling of this fullness in your face. So this is one of the reasons a hidden cause of sinus infections is mold. So mold, it can be found in a lot of old homes, in basements where there's like poor airflow, a lot of moisture in the walls, and that leads to mold growth. And mold spores are, the first thing that comes into contact with the mold spores is our sinuses, our breathing tract. And when they come into contact there, it creates this crazy immune reaction where we start to increase, phlegm or mucus to kind of trap these mold spores. So you get this possibly a chronic fullness in the head, headaches, stuffiness. All those can be caused by this mold. So some of the symptoms or some of the signs of growth is you notice a smelly or musty odor. You can have that mold color, you notice like that black spots on the walls, moisture issues. So any kind of poor airflow, poor ventilation will result in that moisture kind of remaining. And if you notice symptoms of allergies, so sometimes allergies and mold can be confused. You think it's allergies, but it can actually be the mold that you're breathing in your house or your workplace. A lot of buildings now, I know we're not really, we're working from home now, but a lot of buildings are really old, right? They don't have the proper ventilation set up that could be that could result in mold growth. So symptoms of allergies is you can get frequent sneezing. Sometimes you can have trouble breathing, right? You get the wheeziness, runny nose, itchy skin, you get the hives, redness, a lot of mucus production, sometimes coughing too, watery eyes, itchy eyes, stomach aches. And these allergies come in very quickly, right? They're very instantaneous. So people that have, for example, hay fever allergy or pet allergies, you'll notice instantly your eyes will start to water, or you'll feel sinus congestion or itchiness. So that's something to kind of think too. If it's an allergy symptom, it'll be a little bit more quick, and you'll be able to notice the triggers. Now, if you're at home, it can be because of dust. You can have a dust allergy and those things that will irritate those sinuses. So it'll feel like it's happening all the time, but that's because this allergen is with you, in the house. Nasal polyps are, think of them as like grapes. They look like little grapes that are hanging off into this sinus. And they are really, what happens is after a long time of, let's say your sinuses are really congested, they're really inflamed, the cells kind of start to form into these little growths. And the worst thing it can do is it can actually block the drainage of the sinuses. So especially if it's kind of placed in a location where there's a draining hole, and it will block that drainage. And that's why nasal polyps can be a cause of sinus congestion, right? It's not stopping that drainage. Risk factors for polyps is asthma. Once I said chronic sinus infections, because it's constantly irritating those cells, so it starts to grow. Cystic fibrosis too can be a risk factor for polyps. Hay fever, so allergy to aspirin. So these are things to kind of look into and think about. And of course, some symptoms of nasal polyps is if you're a mouth breather, if you have already a nasal obstruction, constant runny nose, or sense of smell, like loss of that sense of smell, can be symptoms of nasal polyps, because it's kind of preventing you from taking a deep breath. So food sensitivities and versus food allergies. Food sensitivities are, things that take a little bit longer. So you would eat certain food and then you would notice some symptoms like bloating, joint pain, weight gain, eczema, you feel tired. But this kind of happens over time. So even up to 72 hours after eating these foods. Whereas an allergy usually happens, it started when you were little and it kind of kept going, and this is very immediate. So you eat a food like peanuts or shellfish, for example, and all of a sudden it's hard for you to breathe, or you have a skin condition, like skin starts breaking to hives and indigestion. So that's the main difference. And food sensitivities can actually be developed at any age. So that's why it's really important to keep an eye out on that, because you can over time get more and more sensitive to more and more foods. So too much histamine. So histamine is a very interesting molecule. So we need histamine, but we also can't have too much histamine. Histamine is released by our immune cells called mast cells. So mast, like the mast of a ship or a boat. So histamine is a kind of an little immune molecule. And when you have too much of it, what happens is you get rashes, you get tears, nasal congestion, you might feel really like wide awake or just hard to breathe and sometimes. And what can increase histamine is it could be an allergen, okay, or it could be food sensitivities. So eating too much food containing histamine, so things like wine, cheese, fermented foods have a lot of histamine, deli meats, sausages, those can contain a lot of histamine. And if our body can't digest and break down that histamine from the food, it's going to kind of go and circulate in the body. So DAO right there is the enzyme that breaks down histamine in the gut. So if you have too little of that or something's blocking it, then you're going to have all this histamine from the food kind of free flowing in the body. And these are some of the support strategies that we can do for sinus congestion. So because it's congestion usually means it is a sign of inflammation, right? It's the body's response to stop this inflammation. So we have to do anti-inflammatory nutrition. We got to lower your inflammation. So we can eliminate food sensitivities to do that. We can consider a low histamine diet, improving your gut microbiome, cleaning up your air quality, the air you're breathing. Acupressure techniques are great as well to drain the sinuses. Essential oils to open up those sinuses more. Neti pot is great as well. You can sometimes even consider using colloidal silver sprays, and immune supportive nutrients can be great as well. So the best anti-inflammatory foods are things that are least processed, the ones that have been kind of sourced from the earth, things like wild-caught salmon or grass-fed beef, grass-fed butter, ginger, a lot of spices, extra virgin olive oil, coconut oil, lots of fruits and veggies, right? These are going to be amazingly anti-inflammatory. And we want to cut down as much of the pro-inflammatory foods as possible. So this is lots of high sugar, lots of breads and white bread, grains, sodas, burgers, and pastries and things like that. So having that balance is really important. And so following an elimination diet is what you can try for 2 to 3 weeks to see if certain foods are triggering you into getting these sinus infections, or sinus congestion. So what the most common irritants tends to be gluten, dairy, and eggs, those three. Sometimes corn as well, and sometimes soy because they're more genetically modified. So avoiding these common irritants first, you can do it one by one, so you can really pinpoint out what is causing you the irritation. You can read the labels to see which ones are not containing, which foods containing, which foods don't. Make sure you use a food journal as well. So after you eat that, notice if you feel stuffy or bloated or tired. That could be an indication your body's having an adverse reaction. Like, for example, just the other day, I recently had some peanut butter that I haven't had in a long time, and I felt very tired after. I felt like it was hard for me to focus. So I realized, peanut butter does not seem to be good with me. My body doesn't seem to agree with it as much. And then what you do is after the 2-3 weeks of complete cutting it off, you begin to add that food back in a slow manner. So to see how, if they're still affecting you or not. And observe for changing the symptoms. So observe to see, are you noticing the symptoms are getting better? Or are they kind of staying the same? So maybe then that might not be the food that was actually triggering you in the first place. So these are some things to kind of consider when you're trying an elimination diet. And of course, I'm here to help you with it and to guide you further into how to do it in a proper way to keep you accountable as well. Histamine-rich foods. So we talked a little bit about these foods. These are the foods that are fermented. Foods like cheese, foods like wine, chocolate, mushrooms can have it too. A lot of the condiments, so things like salts and peppers, the flavorings can contain histamine. Dried fish, preserved meats, nuts can also have histamine too. So peanuts, and vinegar can have histamine as well. So these are some things to keep an eye out for and to reduce if you're noticing that there's an adverse reaction and how it affects our health. So we talked a lot about why the intestines are so important for helping with so many things, right? In terms of inflammation, reducing that, increasing our quality of life. And they're really a good, healthy digestive system is so important for immunity, for absorbing nutrients, for increasing our metabolism, reducing our inflammation. So if for some reason if you're noticing, signs that your digestive system is off, so these are things like diarrhea, constipation, bloating, gas, heartburn, come and see me because I can guide you. You can see me or another practitioner like Sabine, for example, too. We can help you guide to see what's really going on in terms of your digestive health. Benefits of having an air purifier. So because our sinuses are like the first exposure, so the first barrier almost from the air into our body, they can be really severely affected by air quality. So having a good quality air filter, so I always recommend something called a HEPA filter, HEPA filter. It can filter out dust, allergens, bacteria, viruses, yeast, mold, all of these big particles, and pet dander and all those allergens as well. So even if you have it running in your bedroom or in your living room where you spend most of your time, can be really great to increase that air quality. Acupressure. So I love using acupuncture, as some of you might know. There's some really great acupuncture points especially on the right beside your nose. So this point right here is great. There's points right in your by your sinuses here. This is a great explanation of where there's internally as well, and this helps to really kind of increase that sinus flow. Sometimes I also kind of like to just drag my finger over my sinuses to help reduce that pressure to it if I ever have a sinus congestion. How to use essential oils. So essential oils can be really fantastic, especially when we are breathing it in. You can place 3 to 4 drops and have a cup of water, and you can just have it just in the room, or you can use it with a diffuser. It's fantastic. You can inhale it. You can sip it directly from the bottle, or you can rub a little bit, and just dab a little under your nose, or sometimes even in your temples. It can help with relaxation of the headaches and things like that. And you can sometimes ingesting, but I do warn you, essential oils should be very cautiously ingested, very small amounts, not too much, because they're so highly concentrated. They can lead to poisoning and things like that. So I don't recommend ingesting, but inhaling, diffusing, and topical use is all good with me. How to use a neti pot. So neti pot is another great way to clear your sinuses. So this is, make sure you do use filtered or purified water. So not just from the tap water. So if you can boil it first and then use it, that's ideal too. So you can, basically this is a great way to clear the sinuses, and it's fantastic. It's something to do, especially if you're noticing you have a really stuffy. You can even add a little bit of salt into it to kind of help drain that fluid even more. So this is a silver spray that Dr. Jockers recommend, and colloidal silver is actually a really great source of it's antimicrobial agent. So if you thought of back in the ancient times, in the Greeks and Romans, they used to eat in silver spoons with silver plates, because while they were eating or drinking, they would be absorbing some of these ions. And it was nowhere near a toxic amount, but it was helping their immune system. So colloidal silver is similar because it's dissolved in water. It's nowhere near where it's a dangerous amount, but it helps your body kind of fight these infections and molds, for example, too. So it's a great something to take, but I do recommend coming and talking to somebody, talking to myself before you try these products, because we can see what works best for you. So D3, K2 are some great vitamins that can help with immune function and bone production as well. And so it's also a supplement that I'm going to talk a little bit because I want to support Dr. Jockers as he provided this information. So zinc mineral is really important for our body's immune function. It's great for skin. It's great for immune function. It's actually great for stomach acid as well. And some deficiency symptoms are actually spots on your nails. So if you notice any white spots on your nails, that could be a sign of low zinc. You can have low energy. They can also have, you feel anemia, loss of taste or smell. That could be signifying of zinc deficiency. Skin rashes. There's a lot of things that are kind of controlled or affected by zinc. So these are some of the symptoms. Even hair loss can be a sign of zinc deficiency as well, because zinc is such a wonderful mineral. And thing is, our body doesn't really have storage capacity for zinc. So that's why we need to have it regularly with our diet to keep it, keep it in the body. Benefits of vitamin C. So vitamin C is fantastic for immune health, making sure our immune system is functioning properly, helps our adrenal glands. It is great for joints and skin, blood flow, healthy aging, and it helps with the histamine response. So, it can help kind of lower the histamine response and kind of help regulate it better. And, you can get vitamin C from supplements, and a lot of citrus fruits contain a lot of vitamin C as well. And of course, feel free to let us know your feedback. We always value that, as well as any ideas you have for future talks. Feel free to reach out to us with Facebook, Twitter, YouTube, Instagram. You can give us reviews. All that is all available. So we really appreciate all of that help.
So Dr. Udani, I wanted to thank you for your talk this evening and really bringing a doctor's perspective into our congestion and really the causes, and then what we really can do for ourselves to help ourselves through that. Thank you so much for being with us this evening.
Thank you so much, Angela. And thank you for everybody as well. Have an amazing rest of your evening.
Have a good evening.
Bye.